Hello everyone. Thank you for taking the time out to watch my video. I've been wanting to do this documentary for a while now. I wanted to let people know about what I'm living with because this may help someone else that's living with the same thing and don't realize that there are other people out there that has it too. So this document is called My Journey of Living with ILD. Most people may say, what is ILD? ILD is interstitial lung disease. It occurs when you have scarring of the lung tissue. This scarring of the lung tissue is irreversible. There are some treatments that can, temporarily slow the disease progression. And with that, with ILD, you have so many different symptoms that some people may have. Everyone may not have the same symptoms. Like there's the chronic cough. I have the chronic cough. Anyone that knows me and has heard me cough before know that I have a chronic cough. With all of this corona going on, I get certain looks and stuff. People think that I have corona. No, I have ILD that gives me a chronic cough. Also, there's shortness of breath. Yes, I have shortness of breath. And I have shortness of breath also because I can only take in 19% of air, which is basically hardly anything when you look at it compared to the normal person taking a breath in. Also, there is what they call deformity of the nails, which aka is called club fingers. Luckily, I do not have that yet. My doctor said if I do get it, that means my oxygen is dropping even lower. And also there's weight loss. I have not experienced the weight loss yet, which I wouldn't mind because you see I done got a little chunky. But, only if it was healthy weight loss, not because of the ILD. There are different treatments that one can get, to help slow it down, which is steroids. I've been on steroids before to try to help it. Lately my doctor was like, they don't want to put me on steroids because they don't know which lung disease I currently have. Because ILD, there's over 200 lung diseases possible that I could have. So that would be a waste of their time. There's also pulmonary rehabilitation. I've been to pulmonary rehabilitation. They teach you how to do exercises for someone that, suffers from a pulmonary disease. Not just ILD, asthma, bronchitis, COPD, and everything. And there's also supportive care. Supportive care is oxygen therapy. That is what I have here at my home. I have oxygen. I have the one for home, and I have the one that I can take with me if need be. It took me a while to get used to having to wear oxygen, especially when I'm at home and everything, because I didn't like the tube in my nose because it felt like I was getting more oxygen taken away than what it was putting in. You know what I'm saying? So I was like, let me get used to it because this will help me be able to sleep at night because, you also get fatigue, and then the inability to exercise throughout your whole body. You're just tired. You don't know why. And you don't have that motivation to want to exercise or do anything almost. Also, let's go back to when I was first born. I was diagnosed with asthma. So I had been living with asthma all my life. Most people they'll disappear. They have no more problems. Me, I wasn't lucky enough to have my asthma to disappear like most, which would have been nice. And so over the years, I've taken pulmonary tests, function tests to keep an eye out on my lung function. So over the years, it started to decrease, and over this past year, it really started decreasing. And so the doctors was worried. I've got multiple bronchioscopes, dude. That's when they go down your throat and wash the cells and get a piece of the lung tissue to send off the testing. So I've gotten that done several times, and it's always come back inconclusive. So this past December, to which many people do not know, I had lung surgery. I was shocked when I had to get it because I knew eventually that I was going to get it, but I didn't think it was going to be so soon. So when it happened, I ended up in the hospital. The procedure was 6 hours from the time I went in to the time that I got out. I went to ICU, and then I went to recovery in a room. I have a great support system whenever I need it. Always there for me, and I'm thankful that I have them in my corner. Who could ask for a better support team? So they went in with the lung surgery, and they took a piece of the lung this time, actual piece of the lung. I had chest tubes, was on pain medication. I had to get up, walk around, and make sure I don't get no blood clots. I did almost have fluid on the lungs. The fluid went to my heart, and it was traveling to my lungs. Luckily, they caught it in time. That's because I was eating so many popsicles. I was taking in too much fluid, they said. So they had to put me on a restriction of fluids for a few because I was taking in too much. And so I stayed in the hospital for 4 days, 4 to 5 days. And I was so ready to come home at one point and get my recovery on and whatnot. The chest tube that they put in there, let's back up. The chest tube, it wasn't as painful as I thought it was going to be when it came out. I didn't even feel it, to be honest. Only thing I felt is when she put the stitch in to try to close up the hole that the chest tube came out of. So a few weeks later, they get the results and everything, and the results was still inconclusive. So Dr. Gressons decides to send me to UVA, to Charlottesville, where most of you all see me post that picture saying here with my support team. That's what I was, UVA, trying to get some answers for my ILD. Since it was my first visit, she couldn't give me much information. She could tell that during the exam that she could hear bronchitis in the lower part of my lungs. I took a pulmonary function test while I was there. I did a 6-minute walk with oxygen while I was there also. And so, they are trying to figure out what is going on. I go back to them in probably a week and a half from now, from Tuesday. Matter of fact, a week from Tuesday, I go back to Charlottesville to do my second pulmonary test so they can have something to compare it to with the first one to see how I'm doing. This ILD is something that I wish and hope that no one has to ever experience. It took a long while to be diagnosed with something because I was always at the pulmonary doctor and they was trying to figure out what was going on. Not only that, along with the scarring, I have what you would call nodules / mass on my lungs. I probably have about 12 of those on my lungs or so, maybe a little more. and they keep an eye on those too to make sure that they're not growing uh, and everything. So I just wanted to give you a little bit of input on what I've been going through and having to deal with, and maybe hopefully this video will help somebody else. I will be making another video soon to document more of me living with ILD.